The member from Simcoe Grey.
Speaker, my question is to the Minister of Health and Long-Term Care. Speaker, in May, I asked the government why my constituent, Mr. Jim Lees, who was classified as a crisis patient by the Community Care Access Centre, why he has to wait several months for a long-term care bed. In June, I asked the government again about Mr. Lees. In July, I wrote to the Premier directly. I have followed up with the Minister's office and the Ministry and the government each week since July, and yet the government still has done nothing to help this man. Now here we are in September, and the plight of this poor man remains the same. He is no closer to a bed in a long-term care facility. So I ask, Mr. Speaker, Minister, when can Mr. Lees expect some help? When can Mr. Lees expect to get a bed in a long-term care facility in this province?
Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. And Mr. Speaker, I appreciate the question. I know that the Associate Minister of Health has been working hard on this issue. I believe that the member opposite has had dialogue, discussion with her, including through correspondence and with his office. When it is a matter of obtaining a long-term care bed for an Ontario citizen, we work as hard as we can through our CCACs and our partners to ensure that that bed can be provided, particularly for urgent cases such as the one referenced by the member opposite. I would be happy to follow up with the Associate Minister, as with yourself, to see what has transpired over the passage of time with regards to this individual. But as I mentioned, we have a minister responsible specifically for long-term care that I know has been working hard on this issue.
Thank you.
Well, Mr. Speaker, through you to the Minister, Minister, you gave me that assurance 3 times already in this House over the last 6 months. It's getting to be ridiculous. I'm a former Minister of Health. If I did the job that you're doing, I'd have been fired as Minister. Mr. Lees is stuck in a retirement home. He's an urgent care patient, a crisis patient. That's as high as you can get in all the categories your ministry has. He should be in a long-term care facility. He has to be in a long-term care facility. He's deteriorating in the retirement home, and your ministry is doing nothing. And each time you slop it off to your associate minister, and she does nothing. She sends me emails, and I've got 12 of them here. In the last 2 months, our staff are working very hard with his family to ensure Mr. Lees gets the safe and secure placement he needs. And I get that time and time again, October 6th, July 28th, April 30th, August 25th, and on and on and on.
Question.
Do something. For God's sakes, you're in charge of the system. You're the man in charge. This man needs help. He paid his taxes. He was a volunteer in our community. He's a great guy with a great family. We're going bankrupt, and he's not getting the care.
Thank you. Minister.
Well, Mr. Speaker, when the member opposite, who I know is a former Minister of Health, he may choose to judge me, but I'm actually going to rely on the opinion of Ontarians with regards to my performance as Health Minister. I'm not going to be judged by the member opposite. And I have to say that the Associate Minister has been working hard on an issue which is important to her, and it's important to me as well. When it comes to long-term care, Mr. Speaker, we've introduced measures recently, including substantial investments to increase the number of long-term care beds in this province, to redevelop existing ones as well, so that even more Ontarians will have access to long-term care in this province. But as I said in the first part of this question, I would be happy to address this issue with the member opposite, as well as with the Associate Minister responsible for long-term care, so we can find a solution to this issue. Thank you, Mr.